Hello my friends, today we have three main topics. One is vertebral column functions. Second is lumbar puncture, and third is epidural anesthesia. Okay, let's begin. Here is spinal cord, spinal column. You all are familiar with it, I think. It's frontal plane. It's posterior, and it's lateral. If you see this frontal plane, you notice that these vertebrae on the top are much smaller than lower vertebrae. Smaller to larger, and most larger is here and here. Why we need this difference between vertebrae? It is because of spinal cord's main function. Main function of spinal cord is to support weight, and to support weight it needs to be strong, and for support weight of human body, so it needs more strong bones here. And logical clinical correlation is that traumas of skeletal column is usually on this region, lumbar region. Why? Because it supports more weight. So traumas is more frequent is here because it supports more weight. It's lumbar vertebrae, lumbar region. Is thoracic region, is cervical region. Okay, human spinal column has 33 vertebrae and 31 pair of spinal nerves. Spinal nerves coming from here. Here, if we look at the lateral view of spinal column, you can see holes here. It is called intervertebral foramen. And spinal nerves are coming out of these intervertebral foramens. This region is tight. It is not spacey region. It's tight, and here is some tissues, and there is very small space, so it's very easy to compress here nerves. And small changes in vertebrae or intervertebral disc also may cause compression of nerves, because here is tight space, not large space. Okay, it's copyright. Okay, another function of spinal column is protect spinal cord. Spinal cord is here, inside here, and I want to show you. Here is vertebral canal, and spinal cord is here. Spinal cord is up to one or two lumbar vertebrae. So he is not so long. It's here. Here is L1 or lumbar vertebrae 1. Here is second. So spinal cord is somewhere here. Okay, this is spinal cord, and we need spinal column to protect spinal cord. Two main function of spinal column is one, support weight, and second, protect spinal cord. Let's see now here. We said about this intervertebral foramens. Spinal nerves are coming out from these intervertebral foramens. And now let's talk about interlaminar space and what we need interlaminar space. It's very important issue. Okay, let's talk about if you see, here is some space here. Here is vertebra, here and here and here, and here is space, here is some space, here is some space, and here and here and here. These spaces are only interlumbar vertebrae, not other, only lumbar vertebrae. So we can use this space for injection or needle approach, and these spaces are called interlaminar space. Interlaminar space. They exist only lumbar level, as I said, and this interlaminar space is clinically important for puncture. Where we can puncture, what is most common sites of puncture, and this is called lumbar puncture. Most common sites of lumbar puncture is between L4, here is L4, and L5, here, between L4 and L5 here, and between L3 and L4 here. In this two region, in this two space is space for lumbar approach, lumbar puncture. Okay. Now let's see here. Sorry, here is some notifications and I turn off them. I don't allow these notifications here. Okay. Lumbar puncture performed only in lying position or in sitting position. When spinal column is flexed. Why we need this flex spinal cord? We need because we need more space for injection, and when spinal cord is flexed, it's easy to injection. Okay. Another lying position, and here is lumbar puncture. As you see, this puncture is made between L3 and L4. This is L2, and here is end of spinal cord. Now let's see layers pass through lumbar puncture. Here is layers: skin, superficial fascia, deep fascia, supraspinatus ligament, interspinous ligament, interlaminar space, epidural space. It's very important. Epidural space. Epidural anesthesia is made in epidural space. Dura, arachnoid, and subarachnoid. In subarachnoid space is made lumbar puncture. Okay, and here is sacrum, and sacral hiatus is also important because here is sacral hiatus, it is whole, and also it is possible needle approach from it, and it is caudal anesthesia. Caudal anesthesia is always epidural anesthesia. Caudal anesthesia is always epidural anesthesia, and epidural anesthesia is in epidural space here, and epidural anesthesia is very common during delivery, physiological delivery. This, as you see, this procedure is made between L3 and L4. We use epidural puncture for epidural anesthesia, but we use lumbar puncture for lumbar anesthesia and to get CSF fluid, to put drugs, contrast, anesthetics. lumbar puncture is more complex and more wide, not more important, no, more wide. We can use to get CSF, we can use to put drug in spinal CSF, to put contrast or anesthetics. Thank you for watching, my friends. I hope all is clear. If you have questions, write down please comments. If you like channel, please subscribe, and if you like video, please make like. Thank you so much. Bye.